Hi, I'm Dr. Lee Shu Yen. I'm with the Advanced Eye Clinic and Surgery. I'm a vitreoretinal surgeon and as well as a general ophthalmologist. Common retinal conditions that Singaporeans experience would be diabetic retinopathy. We have a fairly high percentage of the population who suffer from type 1 as well as mainly type 2 diabetes, and a large number would have some form of diabetic changes within the eyes. All these individuals actually require a minimum once a year eye checkup to exclude complications of diabetic changes such as diabetic retinopathy. There are other eye conditions such as age-related macular degeneration, particularly the Asian type of AMD, which we see fairly commonly and have to treat to prevent loss of vision. A large group of retinal conditions that I treat would be complications of short-sightedness or myopia. The retina is the innermost layer of the eye and is the most highly sensitive layer. Occasionally, tears can occur in the retina, which would present as sudden onset of floaters and flashes. If it's only a tear, we can laser these tears to prevent progression to something more serious like a retinal detachment. A retinal detachment would be labeled as an emergency and surgery would be needed to prevent loss of vision. So depending on your underlying risk factor, several things can be done. If you have a history of diabetes, please make sure you keep your control within the normal range and have your eye checkup at least once a year. If you have a family history of retinal diseases, it's also a good idea because sometimes these conditions can be inherited. If you have short-sightedness, particularly higher levels of short-sightedness of 600 degrees or more, it is wise to have your retinas checked to ensure that you have no retinal tears or areas of weakness. But it's important to also note that if there are any new symptoms like a sudden blurring of vision, a sudden onset of hundreds and thousands of little black dots or flashing lights in your vision, it is again wise to get an eye checkup as soon as possible because any condition that is picked up early can be treated much more easily and vision can be saved much more easily than if you had presented late.